Jonathan, show me what the Nano Air Mask looks like.
Yeah, absolutely. Hi, Neil. Here it is. It's got this sort of trifold nano shape, as we like to refer to it. Goes on really easily, and as you can see, you've got a nice nose bridge here, so you don't get a lot of air leakage, and then also, quite good coverage along the side and some protection, if you will, under the chin, so it doesn't really slide up or down. In fact, I could probably do this whole interview with the mask on without having to adjust it, which is great, and it doesn't sit on my face. So this is
So
it.
you can walk around and you can talk, it's not going to slide down.
No, not at all. I mean, obviously there's some adjustment as you sort of move around, but for the most part, this is really designed so that it can stay quite snug on your face no matter what you're doing. And that makes a huge difference, just because it's super comfortable and not, to the point where you're fidgeting with it. As you see, most people, they've either got it down here, or as Cuomo talks about, they've got it on their chin, which kind of defeats the whole purpose.
And they filter out a lot of particles.
Florida Atlantic University, and Dr. Manhar Danak, who is the chair of the engineering department. If you go back to the, I would say probably February, March timeframe, he did a very interesting study which showed how far particles could travel without having something to sort of block them, like a mask. And really what he was trying to demonstrate is that we should all be wearing some sort of face covering. And that really resonated with us. And this is well before the CDC even said you should wear it to protect others. And then more recently, in late November, they said, they sort of updated the guidance to say, look, masks will also protect you. So well before that, just given the background that we have in Asia, and what we were watching and earlier on this year, and their ability to really curb the spread through the use of face coverings, was something that we knew was going to be important. There's no question that the quality of the fabric you use in a mask is going to really dictate how much and what size particles can get through it. You have to be careful, because when you talk about particulate filtration, there's also leakage potentially on the side. So if we set that aside for a minute and we just talk about, if you were to try to shoot particles through the fiber itself, which is what Dr. Danak was doing, he was demonstrating, and he's done this, I believe with over 100 masks. I'm not sure what the number is, but that, what you use as that filter actually makes a difference. And whether you're using a gaiter or, some other sort of cloth material, these very sort of microscopic size particles will get through it. I believe in his study, he was looking at droplets that were about 5 to 10 microns. And the reason for that is aerosolized droplets are usually between 5 to 15 microns. So if you're thinking about, something that is carried on a vehicle, such as a droplet, does that mask actually filter well or not? Again, just going through the fabric. And what he demonstrated, I think, quite elegantly, is that this particular fabric, which is lined with nanofiber, did a very good job of at least blocking anything that gets through it. Of course, that doesn't talk about what gets through, depending on the fit, etc., that might leak in from the side. But all else being equal, the fabric clearly blocks more.
So I saw somewhere, and maybe this was Florida Atlantic University, that said that it was similar to an N95. Now, this is an N95.
Right.
What's the difference? Now, you put this on, it's very tight. So what is the difference? It's pretty heavy too. That seems more lightweight. What's the difference between N95 and the Nano Air Mask?
Right. So as you're aware, N95 refers to a study that, or a certificate or approval by NIOSH. So NIOSH sits within the CDC, or the Center for Disease Control. It stands for the National Institute of Occupational Safety and Health. And really what they're doing is testing to what extent particles that are 0.3 down to 0.3 microns get blocked by the filter. An N95 mask is technically a respirator. So it's not only looking at to what extent particle gets through that, but also around the side. So fit is very important. So an N95 has that classification. This mask is not an N95. What you just showed is actually something that's called a cup design. Obviously, this is a little bit different. It's more comfortable. That is tighter. If you see here, this has an ear loop. The N95 version of this, when it becomes available, or a mask like this would have the full head straps, and it gets tested. Exactly. What's interesting is if you think about the number one testing lab in the country is Nelson Labs, based in Utah. They independently check medical devices and test them all the time. The sort of first stop along the way to getting N95 approval is with Nelson Labs. And so they do what you might refer to as sort of pre-qualification testing. And in those tests, again, even though this is not, I want to be very clear, not N95 certified, the filtration efficiency was about 98% on average. So very, very high filtration efficiency. But, and inhalation, exhalation, which gets to breathability, was also quite good. But, obviously the sort of issue that we all need to be focused on as well is leakage, regardless. And that's true of N95, right? So if you don't get fitted for N95, the one that fits my face may not be the one that fits your face. And so fit is a very important part of all of this.
Well, the reason why I bring that up, especially, is at the beginning, in the first wave of this pandemic, we're now in the second wave, and we're seeing the hospitalizations go up again. And in the first wave, there was a lot of talk about N95s, protecting those, saving those to the healthcare workers, because they're the ones who are coming in contact with people who need a shortage. Are you seeing an uptick in people buying the nanofiber masks because the N95s, they want to save it? What are you hearing from customers?
Absolutely. So, the one thing I'll say is that when we started this business, and really, we're going back into sort of the late spring, early summer, we were just like you and the folks listening and watching, right? We had families, we were looking for masks. N95 masks were not only something that you should set aside for, first responders and frontline workers, but the reality is they were nowhere to be found anyway. In fact, states and federal agencies couldn't find N95. So the lack of supply was really problematic, especially as this was spreading across the world at the same time. So whether or not you thought N95s were good, they weren't really something accessible. We certainly wanted to offer something that was an alternative to the cloth mask or the typical sort of do-it-yourself. If you remember, there were lots of kind of tutorials on how you could sew at home a mask, which sounds cute and that's great, and we applaud that effort. But the reality is that there is technology that exists that's phenomenal. It's not sort of N95 and then everything else. That is absolutely not the case. There's a difference in quality, and so we really tried to sort of offer and identify something along those lines. I think people are still looking for N95s, and there's certain folks who actually need that level of protection. There's no question about it, but I still think there's a huge lack of supply in the marketplace across the world. There's no question about that. More and more production is being ramped up, but better quality masks are being made and offered, and that's fantastic. And we're trying to offer something that works. And if we look at our customer base, we're and the folks that we talk to, we supply to lots of professional sports teams, athletes, and owners across most major sports, which is fantastic. They have the resources to do the diligence quite quickly. Some of the sort of top 3 tech companies in Silicon Valley. That's fantastic. But and we're humbled to do that. But given how we grew up and what we were seeing, I grew up in the South Bronx. We wanted to not only do something that would work for them, but for that was affordable and would actually try to help make a difference.
John, what was the opportunity that you saw when you created this? What was the initial get into the market? Was it following everybody else, kind of getting into master, or creating that, like you said, to advance the technology?
I think we were relatively early. I mean, if as we were discussing, but earlier, have spent on and off almost 30 years in Asia, primarily in Japan. My wife is from Japan, and a lot of experience there where whether it was for MERS or for the flu, just even for the common cold, sometimes it's not uncommon to wear a mask. I think last year, and don't quote me on this, but I think, the consumption was around 4.5 billion masks in Japan, for a country that's half the size of the US. So there's really quite a bit of an appreciation and sort of respect for the ability to kind of reduce spread generally. So I came along with that kind of thinking in mind, and we saw how well it was working, whether you look at Taiwan, Singapore, South Korea, Japan, China was doing some different stuff. And so we were very early on to want to adopt and bring something like that to the US market. And at the time, I can remember in March walking around with a mask, and that was when the Surgeon General and others were saying, hey, don't wear a mask. If you don't have COVID, don't wear a mask. And people were jumping out of the way while I walked down the street. But we just knew there's something to it. And you know what? It's not that hard. So the idea of, we certainly were not following anyone. We were really early, and I think, we just decided to, we were completely self-funded. We had no time to even think about, going off and trying to raise capital. It was, how can we sort of marshal the resources that we had and the access that we had to kind of bring something like this to the market as quickly as possible.
Where are you manufacturing these masks?
So these masks are being manufactured in Long Beach, California, which is great because it just helps, trying to manufacture. Look, I mean, I think there's no question that the local production capacity across the country is probably not enough to meet the demand. And so, you have states like California, which are, I think they're purchasing up to 200 million masks per month, if I'm not mistaken. And that's just for California, and they may have some arrangement with other states. So, the idea that you're going to have to purchase from abroad is fine. I don't think there's anything wrong with that, but being able to locally source where possible is fantastic. We certainly are open to and are actively considering, how do we not only, sourcing locally is one thing, but we also are very, very sensitive to price. And we think, the more affordable we can make this and offer something that really works, the better. We're also listening to our customers. I mean, you were talking about that. We get a lot of folks who want black, they want blue, they want green and gray and different designs. And for us, it's, in the beginning, the sort of, we just sprung into action. It was like survival mode, right? Like, let's just get something that's phenomenal as quickly as possible, that's scalable. And we did that. I think now we're realizing, okay, we've sort of stopped the bleeding a little bit. I mean, it's sort of ironic to say that because the country is really, in a tough place, but in terms of production capacity, et cetera. But, we if by us not offering a variety of colors or patterns, you're not going to wear this kind of mask, that's a problem, because that means you're going to resort to something that's perhaps less good. So whether it's, very thin melt blown fiber, I mean, there are other fabrics that do a great job with filtration. One of the things that we pride ourselves on is the shape of the mask. So, as we were just talking about, this shape happens to be very, very comfortable. And again, much easier to talk. So to the extent that we can keep that shape, offer different colors that folks want, we get a lot of companies that want branding on the mask. So we're really sort of constantly innovating to make sure that we are offering exactly what they want. But, the one thing that we won't compromise on is the quality. And whether we get that, from the US or if we have to source it from somewhere else, that's fine. But, we're constantly involved in that process and making sure that there's, our sort of stamp is on it.
How much does a mask cost?
So these masks were initially, retailing at $4.50. At the outset, this was just, there are a lot of relatively high costs. We were able to get that down most recently to about $2.70. The goal is to get it down from there. We get the fact that this is a disposable mask, and It's although, some people have found that because the filter will last a certain period of time, that, I don't think they're running to the grocery store and then throwing it away. And we certainly don't suggest that people do that, but it's not inexpensive. Perhaps if you compare it to a Starbucks coffee that you might have every day or every other day, which some people seem to do, it's given the protection. I think it's a good trade-off.
Right.
But for something that has, for this level of quality and comfort and breathability, we're doing all we can. I promise you, to try to get that
Yeah,
down.
no, I think people are looking to find a quality mask. I mean, there's obviously so many cheap options, but
Yeah.
they're not really protecting you. And then obviously you could wear a second mask over to protect it if you had to, to
Right.
save you longer,
Look,
right?
I think what's a little bit frustrating is that, going back to your N95 example, I think we somehow have convinced ourselves in the marketplace that there's N95 and everything else, and
Right.
all of the other stuff is the same. And, there's a lot of stuff that isn't regulated that is really more of a fashion accessory. And while I totally appreciate that, and if you want to make a fashion statement, that's fine, but you really shouldn't go off thinking that you're doing much at all. And that's where there's a little bit of a frustration. And, the fact that a lot of folks are being sold in that manner is quite disappointing. But, I think if we can get to the point where we have quality and it looks good and it comes, in the way that customers want it, we're all better off.
How many people are with you right now?
So it's small. I mean, it's
Under
really
five?
small. Yeah, I mean, the extended team is certainly larger than that. Make no mistake, but we realized that we needed to be very sort of nimble and quick. You know, my background is primarily in corporate law and then investment banking, doing corporate finance, and I was at Lehman Brothers and Credit Suisse, and most recently at Deutsche Bank. And since leaving, what I've spent most of my time doing is investing in and advising other companies. So we had some sense. I mean, less being in the driver's seat this way, but we're entrepreneurs at the end of the day. So we kind of figured, just given the importance of speed, we wanted to be super lean. There really wasn't time to kind of develop a team that was large and sort of take our time. So we really needed to kind of ram through. So we've got folks who wear multiple hats. One of my partners, David Sages, has been a close friend and business partner for almost 20 years. He also has a law background. And then, we've got someone on the tech side who's just phenomenal across the board there. And then someone who handles kind of really all of the creative and visual assets, which are really important. And together that sort of makes most of the core team. And then, we do have some other help, to be sure. But yeah, it's hard to move this quickly and be this agile if you're not lean.
And I also know you're doing a lot of community work.
Given where I was from early on, it's a bit different now as we look back, here in December, and we see, that COVID has really spread across the country, and it's in a very sort of indiscriminate way. Early on, I think communities of color, specifically, African American and Latino communities across the country, were being disproportionately impacted. And we saw that, my partner is Black, me being Puerto Rican, and we thought, what can we do to at least help those communities? And, one of the things that we're quite proud of that we helped with early on was a project run by the Allergy and Asthma Network. It was piloted in Atlanta. Sanofi Genzyme sponsored that as well. And the focus was on, just getting into the African American community and being able to, as you just said, how do you educate folks, do a bunch of testing, make sure that they have the appropriate PPE, and really kind of understand what is going on and sort of how to best deal with it. So we're super proud to have done that, especially for a fairly young company. And we look forward to supporting that effort in 2021, and we know that that's going to be spread across the country to multiple cities. And Allergy and Asthma Network is just phenomenal. They're best in class. Something that's a little bit more local, although it definitely is a national organization, is Hispanic Federation. And the work that they're doing is just, incredible, whether it's across healthcare, insurance, education, voting. In early October, well, late October, when New York City started early voting, we were there in Queens with them, and Frankie Miranda was out, and he was, talking about the importance of just getting out to vote. And to help some of the volunteers and some of the folks who were there, we also donated masks. So, we're there to partner with Hispanic Federation across a number of their initiatives. They also just recently did something for Thanksgiving, and a turkey drive, and different food drives that they do. So we're really, really excited about that. And hard to say we're excited, but they're doing real work. We're just, to the extent that we can facilitate and support that, we're happy. We've gotten to a lot of New York City public schools. In fact, the kindergarten that I went to, which is about 2 blocks from, where I grew up. So, we could sort of go, yeah, in the Bronx, and in the Soundview section. I mean, we could go sort of on and on, but it's not something that we talk about much. We don't do it because we want some PR, or we want someone to think of us as a socially kind of responsible, sort of a CSR initiative. It's because we think it's the right thing to do. We are constantly looking for ways to support the community, and that, that I think that's just what should be done. And we're actually inviting a lot of our corporate sponsors. I mean, as I said, we're really fortunate to have some, best in class, sports teams and corporates and law firms and investment banks who are also interested in helping. And so, to the extent that we can, spread the wealth in that way, we're more than happy to do so.
So you mentioned you're pretty much a lifelong entrepreneur. What's next for you? Are you taking, hopefully the pandemic doesn't last too much longer, but what is next for you?
Yeah, it's an interesting question, because I look back, at the beginning of this year, and obviously I wasn't doing this. Much of the other businesses that we were involved in, where we could sort of take more of a back seat, we did. There are other businesses that we continue to have a major stake in, and are doing the best we possibly can to advise from kind of afar, if you will. But this is definitely sort of taken, I would say, all of my time at the moment, and that's okay. And we look forward to the point where we don't have to do this, and it's, we're fine with that. This isn't something that we'll sort of be here, and we'll continue to provide and offer what we are, as long as it's necessary. But for us, we've always been involved with 5 or 6 different, sometimes 8 different things at the same time, where we're actively investing and advising. I saw you did a recent segment with some of the Shark Tank guys, and it's not all that dissimilar, right? We're seeing businesses all the time. We invest. When you invest or advise, you are providing a lot of strategic advice on how you would do something, how you would position things, structuring those kinds of transactions, not only with the client, but with whomever else you're looking to do something. A lot of that for us involves bridging a gap between the US and Asia in some capacity, sometimes Europe. We're super focused on health and trying to kind of make a difference. And it just so happens that luckily this mask, fit into that, but we would have done that no matter what. But yeah, stay tuned. We'll have to come back again. There are a bunch of other things that we're doing and that we have been. It's just, this is the main focus, but I'd love to talk to you about that, because, I'm 46 at this point, and, we've just been sort of grinding away on a bunch of different things. And we're fortunate to be able to kind of work on the stuff that we want to, and pivot, and, bring resources to bear, because we recognize not everyone can. And it's nice when you can do that in a positive way for the community. And this is just one example. So I feel like, what else could or should we be doing? Anything else I can think of right now would just be selfish.
Yeah, and I would think that you're going to be busy the next few months as we get through the holidays and enter the second wave.
Yeah, I mean, for sure. I just had a son about 6 months ago who, I don't want to say I barely see, but it's like, I try as much as possible. But yeah, I mean, we've been busy throughout our careers, but this is definitely, been something that has probably just taken more of our attention than anything else. Look, it's quite frightening to see what we're seeing, and it hurts to know that we're not very far away from being able to do the right thing. I mean, if we could increase mask adoption, the CDC has made it very clear. There are lots of studies which show that not only is the getting the adoption rate up from where it is now important, but the quality of mask you wear is also important, and all of that has a huge impact. And it's not just on public health outcomes, but the economy, et cetera. But that's one tool, right? We've got to do, we have to be obsessive about washing our hands. I think there's no question about that. The social distancing is also important. So, this is just one of the components, and we recognize that there's a lot of fatigue, but we see that it works. Once you can get the transmission rates down and you can sort of take off some of that pressure on the healthcare system, and again, you're seeing it in some parts of the world where they've done really well. They've done a good job of trying to mitigate and keep the economy going, keep kids in school, et cetera. And we look forward to that. But I just, it's tough, right? I think this is going to be a rough road over the next few months, and that's one of the other reasons why we're constantly, we actually just sold out of the masks that we had, and we're looking as quickly as possible. And this is just hours ago, to replenish and like I said, offer have more options for folks. That's something that we really want to do. So
you're ramping up inventory right now, then?
We're ramping up inventory, but we're also ramping up the sort of different types of inventory, because one of the things that we learned is that there's only so much that you and I want in terms of a white mask, right? If we get another email asking about when the black masks are coming out, if I could have a penny for every time we got that email, we'd be in great shape. But we hear folks, we're going to do that, and we're very close. So we just ask folks to bear with us, but we hear you loud and clear, and we're definitely going to do whatever we can. And this just couldn't be a more critical time. I mean, we're seeing great news about vaccines coming out. My stepmother is a nurse. My mom is actually a nurse too, but my stepmom is a nurse in New Jersey, and she's the only thing she's been doing, the only thing since COVID started, is Johnson & Johnson vaccine testing. That's it. So she tests, doctors and other folks who volunteered. Obviously some have the placebo, some got the vaccine. And we're all sort of somehow trying to focus on this. So look, I think it's coming, but this is not a time to be complacent, and that's just what we worry about. So hopefully by the spring we're all good, and we can go into the summer and not worry about this.
But I think the mask wearing is going to be there for a while, until this virus goes away. And you bring up the sharks. One of them who we haven't interviewed, Mark Cuban, always talks about the social aspect of businesses, and that the best businesses now have that social focus. And it seems like that's exactly the path that you're taking on, whatever business it may be or business you may create over the course of your career. Seems like it's socially focused.
Yeah, look, I mean, I'd love to say that was always the case, but that's just not the case, right? As a lawyer and as a banker, more often than not, I was either financing or helping, large private equity firms or investment banks finance businesses, acquisitions, et cetera. And it's not to say that there wasn't a social component, but that isn't, rarely was driving things, right? So, I have my fair share of having done that kind of work, and there's nothing wrong with it. But where we can, we're always looking to do that. And it doesn't always have to be the main focus of the business itself. We advise companies that are doing that. I sit on one of the advisory boards for the Hispanic Scholarship Fund. They're doing phenomenal work, and couldn't be happier about what they're doing, and we're always trying to do more and help in that regard. So I think while I think companies should be responsible, I mean, there's just no question about it, it's the right thing to do. I don't know that has to be the thrust of every business. So you help where you can and how you can, and sometimes it's direct, sometimes it's indirect, but that's always going to be part. It's sort of how I was raised. I think it's kind of like a very New York thing to do, right? Like you just kind of help where you can. And, you know, we can be tough and strong and competitive and all that stuff. Don't get me wrong. We're not pushovers, right? But at the same time, you know, we get where we came from, and we're all part of this community. Look, if we, you know, one of the things, let's just take as an example, right? Sports, you know, one of the things that we're talking to a lot of the professional sports teams, especially in basketball, is, you know, I don't want to go to a game not knowing what the person next to me is wearing in terms of a mask, right? Maybe it's a gaiter, maybe it's a bandana. That just is going to scare me to the point where I probably won't go. If we could elevate and have a sort of minimum standard that, you know, going into it, I can say, okay, that person's wearing a Nano Air mask, you know, perhaps that alleviates some of that stress and maybe makes it somewhat more accessible. So, you know, we're trying to do things like that, but that not only helps pick up the economy potentially, you know, there's all of these different ripple effects. So we can do well, we can do good, and we can kind of really try to help in that regard. So it's definitely something that we're focused on.
That's really interesting. I never heard that before, and I wonder, are you going to approach health officials about this and see if there will be some sort of standard implemented? I'd have to think that if a country like ours were to do that, you know, the virus may dissipate quicker, or, you know, we could get that positivity and transmission rate down.
Yeah, there's no question, right? I mean, I think, look, just about everything we've seen has shown, even with relatively poor quality masks, if you can get adoption rates high, you know, and maybe that's 90, 95%, transmission rates start to go down. The better quality mask you wear, and it doesn't have to be N95, right? So just setting aside N95 for a second, we see that the numbers go down even more. And there's so many models that show this, and this is not just work that's done in the US. You've seen some in Europe. There's a professor, Kawaoka from Japan. He's the sort of leading virologist, and you know, ex Prime Minister Abe had sort of tapped him. I think he has a seat at the University of Wisconsin as well. And he came out with some studies recently, and he shows how, look, you know, masks not only protect those around you, it protects the wearer. The CDC has come out with this, and they've done all of these studies. So, you know, whatever we can do to sort of elevate our game, if you will, as it relates to masks is only going to help. And, you know, we just want to be a part of that. Is there, you know, can we make a standard for the country? I don't think so, and it's probably too difficult. But where you have private businesses or places like arenas where, you know, perhaps ownership and the teams can control it, I think you might, because, you know, and you've seen that in other countries. I mean, it's happened, and, you know, but that requires you saying, okay, here's a mask. The minute you walk in, you've got a good one, take this, right? And, you know, to the extent that you can brand them, and so we've got all of that in the works as well. And, you know, this is true for planes, and you know, our whole thing is like, we get that our customers are people too, and they want to look good, and they want to, right now we're sort of all focused on hunkering down and kind of getting through this. But you're right, we're going to be wearing masks for some time, and we want to give people options in it. But again, it's got to be breathable, it's got to be comfortable and all that stuff. But we want to maintain that high level across the board.
Sure, that would be interesting to go to a sporting event or a concert, and that they tell
Yes.
you, you know, you have
Yes.
to be at this standard or above if there was a, you know, rating system, so to speak, or, you know, or hand out the mask branded. You know, you go to a Met game, they hand you a Mets, you know,
Yeah,
nanofiber mask. That would be interesting.
look, that's exactly what we're doing. So
Yeah.
we're having those conversations. We're actively having those conversations, and, you know, I think it's something that just kind of makes a lot of sense, because it's very hard from the outside to come in and say, well, you know, what kind of mask do you have on? You can sort of set the standard, and you know, I don't know how widely that'll be adopted, but that's true. We're seeing it in restaurants, in hotels, museums. You know, what are the staff wearing? How can we make sure that they're, you know, that you can walk in and at least have some comfort, right? Because we think about air filtration, we're thinking about ventilation and purification. You know, why not have a sense of, okay, like, what is everybody wearing, right? Maybe it's N95, right? So we're not saying it has to
Yeah.
be this. It could be, you know, there are a lot of options, but I think that's going to be important.
I really love what you're doing, Jonathan. I really do, and
Yeah, I
and
appreciate
wish you
that.
best of luck with all of this.
Yeah, thank you, Neil. I appreciate you, taking interest in it, and this none of this is possible without a team that really just works tirelessly, and we sort of try to support each other. But I think what helps more than anything is just knowing that we're making a difference, and we're out at least trying, and we're constantly trying to improve and sort of listen to folks, and we'll keep doing that.
Jonathan, great to know you. Great to meet you tonight. Appreciate it.
Yeah, thanks, Neil. I appreciate it. Thanks for taking the time.